Okay.
Okay, our case collaborative was over traumatic brain injury, and our patient's name was Brittany Wilson. My name is Demi Downey, and for this case, I was like the administrator for the program.
My name is Brooke Young. I was the technologist for Brittany's case.
My name is Rachel Nolan. I was the pharmacist.
My name is Adriana Benedict. I'm hired when I was the physician for the case. So our patient is, as Debbie said, Brittany Wilson. She's an 18-year-old female. Oh, can you guys hear me?
A little bit.
Okay. So our patient's name is Brittany Wilson. As Debbie said, she's an 18-year-old female presenting to the clinic with the primary chief complaint of moderate traumatic brain injury. The reason that we know it's moderate traumatic brain injury, or we suspect it is at least, is because her Glasgow Coma scale score was 9, which is indicative of moderate traumatic brain injury. So as you can see on the slides, we have just some general overview of what the brain is, what the skull is, and what might have happened to our patient as she experienced traumatic brain injury. So essentially, what's the brain? It's a complex organ, as we all know, in our bodies. It uses about 15% of our cardiac output. So that means every time the heart pumps blood out in a day, 15% of that blood is going to the brain. Why? I guess you might ask. Because your brain essentially does everything. It is a regulator of the organs. It's in charge of your speech, cognition, hearing, any automatic behavior such as controlling your heartbeat, your temperature, sleeping. It also helps you execute voluntary movements, so like walking from place to place, even thinking about picking up something. Your brain is involved in all of that. So it's definitely significant that our patient is coming in for this problem. The brain, just there's some more information about the brain. It has an extensive system of veins, arteries, and nerves that surround it. So the two main arterial supplies are from the vertebral arteries that come upwards from the neck, and also the internal carotid artery as well. So we have to make sure, obviously, as we're doing the different labs and looking, that she doesn't have any neck fractures, because that would be impairing blood supply to the brain very, very seriously. The brain has the general 3 parts of the brain at the cerebrum, which is in the front. Can't really point to it very well because I can't reach that high, unfortunately. But the cerebrum is all the way in the front, cerebellum is at the back, and then you have the brainstem. Hopefully you can imagine that. You can see a bit of the brainstem sticking down. It's like the, let's see if I can point to it right here. So the cerebrum has 4 lobes, frontal, parietal, temporal, and occipital. Cerebellum has 3, and then the brainstem is just by itself. But anyway, all of them work together to do what we know that the brain does. Moving on, what is the skull? Which is probably what our patient fractured and what created the impact of the brain that caused the problems that our patient has. So the skull is essentially just a bony framework that houses the brain. There are about 22 bones that make up the skull. 8 of them are directly for the skull, and then the rest of them are for the face. If you add in the bones of the inner ear, then you get, and then the higher bones, you get 29, but that doesn't matter right now. So inside the skull, we have 3 layers. So we have, after the skull, which is the bony part, we have the dura mater. We have 2 layers of that, periosteal and meningeal. Then we have the arachnoid matter. Then we have some cerebrospinal fluid, as you guys all know, in between the arachnoid matter and the pia mater. Then we have pia mater, and then we have the brain. So we know that our body works really hard to make sure that our brain isn't damaged, but over time, especially if you're like a patient and you're involved in something like this, you can have a situation where sudden acceleration or deceleration forces involved in a car accident would force your brain against the skull and cause some kind of tissue damage. And then that tissue damage could lead to maybe impaired blood loss to certain areas of the brain. And we know that if blood is lost, then the cells will die over time, and that's definitely not what we want for our patient. So let's look a little bit more into exactly what our patient has. So she has a non-penetrating, complicated, moderate traumatic brain injury. I know that sounds like a mouthful, so I'm going to break it down. So essentially, it means that nothing penetrates in her skull as a result of her brain injury. It's complicated because there is some swelling of the brain, and we've noticed some bleeding from the MRIs and CT scans, which we'll talk about a little bit later. The rest of the team. She has also experienced some confusion, loss of consciousness, some behavioral problems are expected because her family has also observed that she's had some behavioral changes. She may experience seizures in the future, and she's currently having some brain bleed. In addition to that, she also came in with some other things as a result of her car accident. So she has a spine fracture, she has a right arm fracture, left clavicle fracture, rib fracture, pelvic fracture, and brain swelling. So she has a list of problems, and that is pointing us to a lot of different things that we should be looking out for to make sure she doesn't develop any further health problems. So for example, with the rib fracture, we have to know, is she, like, are her lungs okay? Because if one of the ribs, for example, punctures the lung, then we can have a lung collapse, and we don't want that. We have to, I guess, find out, you know, with her, she also fractured one of her thoracic vertebrae, and unfortunately, she's not able to walk anymore as a result of that. So just different things we're going to have to look out for beyond brain injury because of the car accident. So I guess another physician did some surgery on her already. And so we've been managing the illness, but the rest of the team is going to talk a little bit more about like what their roles were and just the different parts that we played. I'll be back.
So these are some different medications that Brittany is on. So I might mispronounce them, so don't come at me. So Benetoin, 3 times a day. Common side effects are drowsiness, confusion, slurred speech, abnormal eye movement, problems with balance, coordination, and muscle movement. So that drug is an anti-epileptic drug. It's also called an anticonvulsant drug, and this drug works by slowing down impulses in the brain that cause seizures, and it's typically used on brain injury patients to greatly reduce the rate of early post-traumatic seizures. And then the next medication is Versant. And she's on 2 milligrams IV as needed, just for agitation. And the purpose of this drug is to reduce anxiety. It also causes drowsiness and prevents memory events before and during a medical procedure. It's also used to maintain sedation in people who are on a machine that helps with breathing, such as a ventilator, which she was on for about 5 days in the ICU before they transferred her. Common side effects are sleep apnea, irregular heartbeat, and blood pressure, headache, drowsiness, cough, hiccups, which I thought was weird, slow breathing, nausea, vomiting, pain and bruising and swelling, or irritation like where it was injected. And then the last medicine is fentanyl, which I'm sure you guys have heard of. This drug is, you know, kind of a dangerous drug in my opinion, but they still use it for different things. So she's on 50 milligrams as needed for pain. And typically fentanyl is used, you know, for pain, or even it's used with other medicine before or during operation to help the anesthetic work better. So possible side effects are chest pain or discomfort, difficulty breathing, irregular, fast or slow or shallow breathing, lightheadedness, dizziness or fainting, pale or blue lips, fingernails or skin, and then severe muscle stiffness or slow or irregular heartbeat and unusual tiredness.
Okay, so while Miss Brittany was in our care, we did some lab tests. The first lab test that we completed was a complete metabolic panel, also called CMP. So Brittany's CMP showed that she did have a high number on her alkaline phosphatase, alanine transminase, and aspartate transferase. So what interests me in these high rates is that actually shows that her liver could not be functioning at its normal level. So she would need to come back in for another metabolic panel again in maybe 6 months to a year. Metabolic panels are typically done yearly by everybody. If you go to your normal physician, your primary care doctor, they would like to complete metabolic panels on you yearly. The second lab test that we completed was a complete blood count and white blood count, a cell count. So this blood test just provides a list of what makes up the blood and the amount that is found in the vial of blood that was drawn. The vial is pulled from a vein and then sent to a phlebotomist who tests the blood and then brings you back the panel. Brittany's CBC test has showed that she has a white blood cell count. And then her hemoglobin, mean corpuscular volume, and platelet count was actually really low. The third lab test that we did for Brittany was an arterial blood gas test. So this test is actually used to show how well your lung is functioning to take oxygen in and transport it through the blood, and then as well as takes carbon dioxide out of the blood and expel it through the lungs. Brittany's test, this was brought on because she was also facing some coagulation and her blood wasn't clotting as it should have. So they pulled this test and it showed that her oxygen partial pressure was low and that her bicarbonate levels were high. This means that Brittany's lungs were not pulling in the necessary oxygen for her blood to transport it through her cells. This could also cause hypoxia and it is very dangerous. The last test that we performed was a routine urinalysis. So along with the urine test, they also performed a pregnancy test as Brittany is female. She was negative for pregnancy, and they also pulled a drug and alcohol abuse test. Of course, those were both negative. And then, so along with her urinalysis came back within the normal range. The only exception being was that she did have a small trace of blood found in her urine. As for her radiology tests, Brittany had a number of different scans done. When she first came in, she did have a CT scan done. She had 2 CT scans done. One for her head and brain, and that was with contrast, so where they send in the dye so you can see that what's actually affecting and if there's any blood, any leaks in the blood, the veins and arteries in the brain, as well as a whole body without contrast. So Brittany's CT scan showed that she does have damage to the brain along with swelling in the brain, and that she has a thoracic spinal fracture. So for those that don't know what a CT scan is a computer that sends radiation through the body to complete an image. This CT scan is much more in-depth than a regular X-ray. So whereas an X-ray is 2D, the CT scan will actually perform a 360-degree angle for you to look at the different layers and how they are corresponding with each other. The second radiology test that we performed with Brittany was 2 X-rays. One X-ray was to view her on her head, and the other was to view her neck and spine. Her X-rays did show that she has a facial skull fracture and a thoracic vertebrae fracture. Again, X-rays are 2D images created by a computer. They send ionizing radiation through the body to form images. They can take a look at any kind of internal dysfunction as well as possible fractures. And then an MRI was the third radiology test that we performed on Brittany. So an MRI, whereas the X-ray and the CT scan used radiation, an MRI actually does none of that. An MRI uses magnetic fields from a computer that's sent through your body. You lay down, you get in this giant table, and it revolves around you. And using the radio waves from the magnetic fields, it creates an image for your doctor to view. For those that do have a pacemaker or any kind of metal within their body, they do have to speak with their physician before getting an MRI because of the magnetic fields. So Brittany, she did have her MRI, and she had a spine thoracic without contrast MRI. This showed that Brittany had a T6 spinal fracture.
My role as a health manager or administration position, I figured a lot of the prices for her entire stay at the emergency department and then also at the intensive care unit. On the left, we have her emergency department charges. So for just the facility charges, she was only there for a little, like an hour until she was moved to another facility. However, her facility charges came out to be $2,631.22. Her physician charges were $674.94. Her medications came out to $43.75 for the emergency department. And then the labs were $565.09. Her radiology came out to be $5,786.20 for a grand total of $9,764.70 spent at the emergency department. And then at the ICU, where she spent about 9 days, she had facility charges of $27,026.60, physician charges of $2,232.93. And then, as you can see, medications was a little bit higher because she was there a little bit longer. As a total for $278, labs for $515.18, radiology for $2,679.50, and then the other procedures on this part where we didn't have at the emergency department include her brain surgery as a total of $58,009.69. For her ICU total, she spent $90,678.40 for a grand total of $100,443.10.
All right, we just wanted to share some statistics with patients that have had a TBI. So all of these are from the CDC. So statistic number 1 is 190 Americans died from a TBI-related injury each day in 2021. Number 2, there were 214,000 TBI-related hospitalizations in 2020 alone. Number 3, in 2019, about 15% of all U.S. high school students self-reported one or more sports recreational-related concussions within the preceding 12 months. This could include football especially. Males were nearly 2 times more likely to be hospitalized, 79.9 age-adjusted rate versus 43.7. And 3 times more likely to die from a TBI than females, 28.3 versus 8.4. So again, this also falls into why insurance rates on males are higher. They are more likely to get into a motor vehicle accident, as well as they do play contact sports in high school.
Okay, so a TBI is a traumatic brain injury, and then it's defined as a head injury causing damage to the brain by external force or mechanism. And then common treatments are what's called a diuretic, which is to reduce the amount of fluid in tissues, and then anticonvulsants to avoid any additional damage due to seizures. And then for the support, there's a lot of support groups out there. I just named one of them, the Brain Injury Association of America, and I think even caregivers can get on there too and find how to support them. And then some prevention tips: wear your seatbelt when driving, don't drink and drive, prevent falls in the home by adopting handrails throughout the house, wear helmets when you ride a bike or a motorcycle, and then also don't text and drive. Then apply to protect your brain. And then here's some other tips. Some nutrition would be omega, or like antioxidants is like the most important. And you can get some of those from like blueberries, cranberries, green tea. Omega-3 fatty acids, which is like salmon, trout, certain nuts such as pecans and walnuts. And then zinc and magnesium, which would be unprocessed like red meats and dark chocolate. And then for some exercise, they can do things like low-impact activities such as walking or swimming, weight shifts, this thing called the Romberg stance, which involves standing with your feet touching together and your eyes closed, and then alternating your heel-toe raises. And then some lifestyle stuff that you can do is managing your daily life. The sooner you get back into a routine of what you did before, it'll be better for you and your brain and your recovery. Exercise is important, diet, the medication that they prescribe, take it as prescribed. And then some self-care tips, give yourself credit for the things you can accomplish. Your life has changed drastically, so just, give yourself time to kind of get your groove back. Keep track of stress level and emotions. Don't try to overload yourself. Be kind to yourself. And then, ask others who have experienced a TBI, how they coped, and, support is going to be what keeps you motivated to keep going.
Right. You guys can great. So these are some more goals, I guess, from a physician's perspective as well. As Rachel rightly pointed out, it's important for her to increase her omega-3 intake, and especially foods, and also add foods that are rich in glutamine, nucleotides, and arginine for neuroprotective reasons, because obviously, as I think I mentioned before, but it's okay, I'll mention it again, no problem. The traumatic brain injury can cause cerebral death of cells, and some cells that are not vascularized properly. So therefore, some neurotoxic or some excitotoxic neurons and neurotransmitters can be released, and we would need her to upper intake of those foods to improve her health outcomes. Something interesting that I found out in the course of putting together this slide, I guess, is that certain studies recommend that she should up her caloric intake to about 25 to 30 kilocalories per kilogram per day within 5 to 7 days post-injury, because that actually improves her outcomes of survival. It's been found apparently that patients who don't do that end up with very bad health outcomes, and some of them are even fatal. So that's something that we would watch out for and try to get the nurses and everyone else on her care team aware of, so we can do that for her. Another thing to watch out for would be gastroparesis, which is delayed bowel emptying, because that often happens to patients with traumatic brain injuries as well. So if she notices that, or her caregiver notices that, that's something that we should talk to the clinic about to see if we can help with that. Another thing was, as for her exercise, I would say the SMART goal for that would essentially just be to keep it light, but try to get about 15 minutes of activity 3 times a week for cardiovascular and mental benefits. As we know, she lost function in her lower extremities, so she can't really be walking or running. But we would still need her to do some kind of exercise to keep herself active and help the blood circulation and also to help mental benefits because she might be experiencing some psychological symptoms like anxiety and PTSD. So the more that she can exercise, or the more she's able to exercise, it would also help with her outcomes. Other things would be to work closely with PT to salvage any lower extremity function that may be there, and OT as well, and probably swimming because she can still do that even though she doesn't have any lower extremity function. For care, her SMART goal is to follow up with us every 3 months at least. That's the major one, because we would like to know like how she's doing, if any of her blood work is now normalizing, especially the liver functions that Brooke talked about earlier. Just making sure that like everything is fine with the patient. We would also monitor her to see if she would need any diuretics and analgesics, so pain relievers, anticonvulsants as well. We don't want to give her anything she doesn't need, but we also don't want to deprive her from getting things that would help her get better. And we would like her to return to clinic if she has any sudden loss of consciousness or any like dizziness for extended periods of time, things like that. For her activity, the SMART goal would be to join a support group and then also to pair up with OT and PT within the next month. Also try to ease back into her daily routine like school, friends, family, etc. But if she's going back to school, we would like it if she reports any symptoms of dysgraphia, alexia, aphasia she may have, so essentially any learning disabilities or trouble speaking, trouble forming words, trouble recognizing numbers, things like that. That would be important for us to like work with her. Awesome. Okay, so we also put together FLEX goals. So this stands for frequency, intensity, time, and type. Essentially trying to help her get back on her feet with improving her cardiovascular health and strength training, and like improving her strength essentially. So I don't know much about this yet, but I was able to work with the OT on my team to kind of put something together. We consider that because she's just recovered from an accident, so we decided to put the bounds a little bit lower than what they usually would be, to kind of compensate for that, and then eventually as she gets better, we would increase these. But the frequency we suggested for cardiovascular training was 2 to 3 times a week. Intensity, easy to moderate, and then to achieve 40 to 50% of her maximum heart rate. I think the standard is about 60 to 75% or something like that, but we don't really want her overworking herself like that just yet. And then time, anywhere between 20 to 40 minutes. Activities, swimming, rowing, again, not anything that requires her to use her legs, except the OT feels like that's something that we should include. And then for strength training, yes. Frequency was 3 to 6 times a week, is what I suggest. Want her to, for intensity, start light, follow OT and PT recommendations as she improves. Anywhere between 20 to 30 minutes, and for type, for example, biceps curls were ones that we saw were really good for people who might have lost lower leg function.
For my insight, we all helped out on these couple of slides. So define TBI is an injury that affects the way the brain works. A head injury causing damage to the brain by external force or mechanisms. A TBI is typically, it's traumatic. It's going to be trauma by an external force to the head, hit from the brain, hitting the skull front, and possibly causing internal damage and bleeding. Symptoms can include nausea or vomiting, fatigue or drowsiness, confusion or memory problems, dizziness or loss of balance, problems in speech, mood changes, feeling depressed or anxious, seizures or convulsions, agitation, weakness in fingers and toes, and then common causes, falls, vehicle-related collisions, violence, sport injuries, explosive blasts, and other combat injuries. Diagnosis can include the Glasgow Coma Scale, MRIs, CTs, angiograms, and X-rays.
Treatment for TBIs includes surgery, like we mentioned in our case, pain medications to relieve some of the immediate pain, and then long term as well. Psychiatric evaluations, as we've mentioned that she could be experiencing some psychological ailments as well while she's battling getting back to like her regular everyday life. Anticonvulsants, rest, and therapy are very important, along with OT, PT visits. For short-term and long-term implications, multiple fractures, including the T6 vertebrae, a rib fracture, a right arm fracture, left clavicle fracture, pelvic fracture, and facial fractures. And then an incomplete SCI, or C, yeah, I said that right. And then possible permanent of lost motor in the lower extremities. And then mental health effects, I've mentioned this, but depression and then anxiety, just because she's not able to go about life in the ways that she was previously. And then PTSD from the car accident. Preventions of this is maintaining a safe work-life environment, as well as make sure that the airbags in the cars are enabled, wearing seat belts, avoid texting and driving, drinking and driving, and contact sports, just making sure that we're going about that in the most safe way possible.